And now I'd like to welcome to the programme Dr. Una Molloy, who works with the Irish Association for Palliative Care. So thank you very much for coming on the programme. This question to start with is, what is palliative care? A basic definition for people who may not know too much
I
about
would
it.
say that palliative care is about improving quality of life. And it's about really allowing people to live to their best in spite of illnesses or life-threatening illnesses or terminal illness. It's about really working with people to prevent suffering where possible, working together and really working with the patient and the family to achieve goals that they would like to achieve.
Right. And when was the Irish Association for Palliative Care set up? I think I saw, 1993 was it? I saw on the
Oh
website.
yes,
Yeah.
yeah, and so the Irish Association of Palliative Care is an organisation of all. It's kind of a a gathering of all the professionals who work in palliative care. So doctors, nurses, social workers, pharmacists, chaplains, and it's really an organisation that allows them to have a representative voice in the provision of palliative care. And it also helps us to share expertise and to support education and research.
So it's made up of lots of different people with different expertise, isn't it? Doctors,
Yes,
nurses, social
yes,
workers, chaplains, and people like that. Yeah,
yes.
and they kind of all work together to.
Yeah, so it's an opportunity really. I suppose, it's a representative association. So we represent the clinical voice of people in palliative care. So there are other organisations like the Irish Hospice Foundation who promote, the provision of palliative care as an organisation, as a system. But we're the voice of the actual clinical practitioners within the specialty.
I don't think people in general would realise that pharmacists have such a big role in palliative care.
Oh yes, yes. I mean, we would use like I work in one particular hospice. I work in St. Francis Hospice in Dublin, and we have a number of pharmacists on our full-time pharmacists here. We have two full-time pharmacists, and we would really depend on them in relation to, sourcing medication, advice on medication, and all sorts of protocols around managing medication and combinations of meds and ensuring that, there's safe administration of medication. So yes, and in the community and all the hospices around the country and in the community palliative care teams, they'd very much depend on the valuable, it's very valuable to have a pharmacist as part of your team.
You're affiliated to the European Association for Palliative Care.
Yes, so the European Association of Palliative Care is sort of a wider group. So it represents so we're the Irish Association, and the European is a wider group. And like in 2013, the Prague Charter was developed, and that charter was to suggest, and it agreed that everybody was entitled to palliative care, that it was actually a right to receive palliative care. So the beauty of the European Association of Palliative Care is that we can all meet, we can present our research in different countries and learn from each other. And so we start to, we can learn from what's good in one country and improve on that. And there are great variations of palliative care across Europe. Ireland and the UK are very well developed palliative care services, and that may not be so in other countries across Europe. So we assist each other to try and develop the best practice.
And the World Health Organization has a definition of what palliative care is.
Yes, the World Health Organization has a definition of palliative care that suggests that, it's about providing care to people with life-limiting illness. It doesn't attempt to prolong the dying process or speed it up, and it's about supporting families and their loved ones in managing throughout life-threatening illness. And it's about the sort of spiritual, psychological, physical, and social well-being of people, because obviously there's lots of components to care and lots of components to what people need.
And it was set up by one person. Was it Dame Cicely Saunders? Was it
Dame Cicely Saunders. So Dame Cicely Saunders was originally a nurse, and she became a doctor, and she has a beautiful, it was set up in the UK, and she has a beautiful saying that sort of is the kind of important way of thinking palliative care. And it says, you matter because you are you, and you matter till the end of your life. And we'll do all we can to help you die peacefully, but also to live until you die. And I would feel that is the real crux of palliative care. It's about living until you die, but also the piece that you matter because you are you. So one size does not fit all. One size, it's about individual needs and about meeting individual needs.
And initially it was applied just to people with cancer, wasn't it, at the beginning?
Yes. Yeah. So normally when you talk about palliative care, everybody would actually think about cancer. And in 2008, there was a document developed here in Ireland called Palliative Care for All. And for the first time, people talked about palliative care in relation that, that the principles of palliative care would be very useful in other illnesses like respiratory illness, heart failure, neurodegenerative illnesses, and that it would be useful to apply those principles. And I mean, 2008 seems like such a long time ago, and we're still now building on that, and we're building on our partnerships with other care providers in chronic illness and in, and I suppose Care, the big slogan with Care is right care, right place, right time by the right people. And that in the new palliative care strategy, we're adopting that as well, that we want to make sure that we work in combination with other teams, but that not all people need to be seen by a specialist palliative care team, that all healthcare professionals should be provided with education and support to provide a palliative care approach, to ensure that people are comfortable, to ensure there's good quality, and that oftentimes people only see, the specialist teams who work in designated hospices and community palliative care teams if they have complex issues.
And you have various forums like education and research.
Yes,
forums.
We have education forum, we have a nursing forum, we have an ethics forum. I'm part of that ethics forum, and we recently just produced a new document on guidelines in relation to nutrition in palliative care settings. And we also last year, and I had the honour of representing the organisation in the Oireachtas last year when we produced a paper on assisted dying and advanced decision making, and we had the opportunity to present there, and so we come together. So in the ethics forum, for example, that I'm part of, we have we have a speech and language therapist, OT. We have doctors, we have nurses, we have psychologists, we have social workers, we have an ethics professor. So we have a very broad range of people who come together with a wide range of knowledge to really be able to represent the voice of the Irish Association of Palliative Care. So we're a representative voice of what, is in practice.
Yeah, there seems to be a very good definition, adding life to a person's years rather than years to a person's life.
Yes. Yes, and I think that is really important, because unfortunately, I meet people every day in my clinical work who maybe have a shorter prognosis or faced with a life-limiting illness. And so it's important that we find out, what's important to them, what can we achieve for them in their time that they have, and to sort of maybe develop realistic goals where people can make decisions around what they would like to do and what's important to them.
And hasn't it been shown that palliative care improves quality of life and mood and can even extend a person's life by certain
absolutely. And, sometimes people, when they get a diagnosis of a life-limiting illness, they become very disheartened, they lose hope. And so our job is to really, accompany people on that journey and to really let them know they're not on their own. And, when people are frightened or don't understand what's going to happen, they need a lot of support. And oftentimes when they have a chance to talk about their fears, and in the context of the team, like one of us would never be able to do it on our own. We work with social workers, we work with doctors, nurses, we work with the physios, the OTs. I mean, it's incredible. Like in our outpatients department, for example, we have all sorts of programs for people who have, life-limiting illness, who are very sick, and they come in, attend the program to enable them to do more and to improve their quality of life and to give them back control. And so that's about putting life in your years, that's really, and you'd be surprised, when you say to somebody perhaps that you're from the palliative care team or you work in the hospice, people get a little bit frightened. And then they come and they see us and they visit the outpatients, and maybe they attend for complementary therapy is also really, really important. And they're absolutely so relieved and delighted that they've come, but they also know that everybody here is willing to listen to them and wants to help them in any way they can.
It must be a great help to families as well, who have to cope with the.
Look, you know, what I always say is families are often asked to do an awful lot. First of all, you have to face the fact that somebody you love is very sick, and you have to face maybe thinking about life without them, and then you commit to taking care of them at home. And an awful lot of people want to die at home. And I think that's really important that we can support that. But families, and I suppose that would be the one thing, you know, if I had a wish list, it would be that we could have endless, you know, care support at home, that we could give people as much assistance as they needed. So because they want to keep their loved one at home and keep them out of hospital. And it's not easy. You know, I go to visit people at home in their houses, and, you know, I walk away after 45 minutes, an hour, and they're there for the rest of the time, making the decisions, doing what you ask them to do. They're incredible, and families really find they get great support from us too.
COVID-19 and all that must have presented huge challenges for palliative care.
COVID, you know, it's funny you should ask that question. I was just watching something on the TV about 2 nights ago, and it was all about COVID, and suddenly I found myself back there going, oh my goodness. COVID was very difficult because all the things that we naturally do in palliative care, jumping in, being there, staying, inviting families in, you know, letting them stay as long as they want, we had to stop all that. We had restricted visitors just like anybody else. When we went to community, we had restricted of, you know, 15-minute visits. We were supposed to only have one person in the room when we were there. We weren't allowed to gather in groups with families. You know, we had to wear PPE. You know, you couldn't put out your hand, you know, and hold someone's hand. You had to do everything, you know, 2 meters apart. You had to, people weren't allowed to stay with their loved ones when they were dying. And it was very, very difficult. We did our very best, and families knew we were doing our best. But I think that recovery for families who lost loved ones during COVID, and for staff in palliative care, it was very difficult.
I was actually going through that myself as a family member of somebody with palliative care, and the kind of the love that you feel because of the staff who look after you. It's great.
Oh, well, that's great. Thank you for saying that, because that's what we really do try hard to do. And I think when, you know, I think we're really good, you know, to kind of really rallying around people the best we can. And I do believe we did the best we can. And I think it was hard for everybody. I still think people must feel that loss terribly, you know, when they couldn't be with the people they loved. And I think for us, where we naturally invite people in and want them to be there, to suddenly have to say, no, you can't, was very, very difficult. But I suppose if it's any consolation, I can also tell you from the inside out, we did absolutely everything to take care of those people who didn't have their families with them, and to stay with them, and to do absolutely everything we could in our power to make sure that they got the best care and weren't on their own.
You also have an advocacy role, don't you? Highlighting the issue.
Well, you know, it's really important that we can advocate for people, and that we can find out what people want, and we can work with others to ensure that that's what they get, and that we make sure that the patient's voice is heard. That's very important. And that can be challenging, you know, that can be difficult, but we do our very best in ensuring that we help people make decisions, we help people talk around advanced care planning, and trying to establish what somebody would really want in the event that they weren't going to get better, and trying to open those conversations with others. It's very important.
Do you have any upcoming events, special events in the near future?
Well, we have every year, we have our education and research forum, and that's over now. We've just had 3 seminars where people come online and join. So we're kind of coming to the natural end of our kind of year where we kind of, for the summer, then we kind of come back and start. Now we have a meeting in the ethics group. We were supposed to have one last week, but we had to reschedule it. But generally for July and August, we kind of step back a little bit because people are going on leave. But that doesn't mean that there aren't activities going on in individual hospices. That's just the professional representation group. But in individual hospices, there may be, fundraising things going on. And I mean, I suppose, that's the important piece to remember is the Irish Association is that professional voice that represents everybody in palliative care. And within that, there's hospices, community palliative care teams, community units, there's outpatients, there's all sorts of people. And they often run courses and run events to promote palliative care. Equally, the All Ireland Institute of Hospice and Palliative Care really supports the development of education and research in the area of palliative care, and we get great support from them. And then the Irish Hospice Foundation also support the Irish Association in Palliative Care with research grants, and because obviously people need funding to continue research and to do research, and it's really important that research continues. So funding is a big issue. So we're very grateful to our the people who support us in those organisations.
As we're coming to the end, do you have anything else you'd like to say?
Well, I suppose that I'd like to say that, palliative care isn't something to be afraid of. It's something to embrace. And that if somebody you love has been referred to a palliative care team, don't be afraid to ask questions, to open the conversations. I suppose one of the things that we're used to is very much communicating about living and dying, and that can be a foreign language to many people.
And now we've come to the end of our interview with Dr. Una Molloy, and I'd like to thank you very much for coming on the programme.